Daniel Ritchie knows what it means to live at rock bottom.
I was very discouraged. I felt subhuman. I felt not worth it.
And it's there he found a new purpose.
I survived what I did to be able to do this.
A lifeline that grew from darkness and pain.
I'm tired of seeing kids crying over their parents' caskets.
In one word, who is Daniel Ritchie?
A fighter. Every sense of the word.
In every sense. In 2008, Ritchie was on top of the world, winning mixed martial arts fights across the United States, until a broken arm socket required rehab and pain meds.
It didn't only take away any physical pain I had, it took away my emotional pain as well.
Percocet, prescribed for his pain, evolved into a full-blown heroin addiction.
I had become so delusional and so lost in self and in that feeling every day that I forgot how important my dreams and my ambitions were and how hard I had worked for them. I started living in a storage unit. I would sleep on couches. I would sleep behind gas stations.
Then he made a phone call for help. One voice at a treatment center changed his life again.
But something that she did planted some hope inside of me. It gave me this feeling that somebody cared. She told me it was going to be okay when everyone else told me so long I was going to die.
Now, 5 years clean.
Scan this with your phone, please.
Ritchie is fighting to be that same lifeline for others.
What's up, brother? What's going on, man?
Attending events like this one, connecting those in need with recovery options.
Got them bad guy on the street doing nothing.
Let me help you, man. Let me help you again.
Planting the seed of hope.
We can get you to UC, we'll get your medications, we'll get you somewhere. I know it's a big thing, man, and I'm not trying to pressure you, but I want to encourage you.
He knows the fight is far from over. A recent study found Greater Cincinnati is the nation's #1 opiate overdose hotspot. But Ritchie's one-man attack has been successful enough to get a powerful partner in his corner. UC Health's emergency department brought Ritchie into its peer recovery program.
Especially to go back to the hospital that I was once a patient at pretty frequently, kind of intrigued me, I'm wondering how this could work.
The department is the first in our area to integrate peers and volunteers into the medical model. People like Ritchie are trained in how to follow up. In the program's 3 years, peers have reached more than 2,000 patients. Nearly half have been referred to substance abuse treatment.
And so bringing those peers into our emergency department, having them there and having the patient really understand, okay, this person does get it. They've been here and they've come out on the other side.
Ritchie knows how important that is.
Compassion is key. Compassion is harm reduction. That's the missing piece.
It was that compassion.
What's up, dude?
What's up, brother?
Good to see you.
That saved Austin Hurwitz's life this year.
This was the house where Daniel had approached me in early February. I was still in a very heavy state of denial. So I was still in the mindset that this is something that I could fix myself. I don't need somebody else.
He says Ritchie changed that mindset. He's now 9 months clean from alcohol and drug addiction. It's the stories, the interactions, the connections that keep Ritchie going, stepping into this very different ring and winning the fight one-on-one.
None of it was in vain. Everything that I went through, I had to go through to get here, to be the man that I am today.
Now, that award you see Daniel getting at the end is called an Angel Award. It's given to those that go above and beyond in their personal or professional life to help the recovery community. Helena Battipaglia, WLWT News 5.